A broken bone is, well, it's pretty easy to diagnose, right?
Oh, definitely. You just look at an X-ray and there it is.
Right. You see the jagged white line, and the treatment is just totally obvious. You put it in a cast.
Yeah, problem solved.
But what happens when the rot isn't inside a patient's body, but it's like deeply embedded in the walls of the hospital itself? Because you can't exactly put a cast on a toxic institutional culture.
You really can't. And when those institutional fractures happen, the diagnostic landscape becomes incredibly murky.
Gets complicated.
Exactly.
And
It's no longer about fixing a clear problem. It becomes about navigating a system that is actively resisting being fixed.
which brings us to our mission for this deep dive. Today, we are unpacking a really chilling case study on power, silence, and systemic failure within a major Taiwanese medical center.
Right, Shuangho Hospital.
Yes, Shuangho Hospital. We're working through a pretty fascinating stack of sources today. We've got a professional presentation summary on healthcare accountability, some public statements, and a really detailed December 2025 press release from the Taipei Physicians Union.
And it is a dense collection of material. I mean, there's a lot there. But when you lay them all out, they paint a definitive and, frankly, troubling picture.
Very troubling.
It shows exactly what happens when the mechanisms designed to protect highly educated professionals just completely collapse under the weight of hierarchy.
And for you listening right now, I want to be super clear about why this matters to you because, we all think of hospitals as these ultimate bastions of safety.
Yeah, you assume you're safe there.
Right. We walk through those sliding automatic doors and we just assume the people in the white coats are protected so they can focus entirely on protecting us.
Which is a fair assumption to make as a patient.
Exactly. But this deep dive asks a really critical question. What happens to the quality of your care when the safety of your healers is compromised by the very institution they work for?
Yeah, and to really understand how a system fails its people on that level, you first have to understand the specific ecosystem they are operating in.
Okay, set the scene for us.
Well, the sources spend a lot of time focusing on the overarching culture of medicine in this region, specifically referring to it as the White Tower.
Okay, let's unpack this white tower concept. Because it sounds a bit poetic, but the sources make it pretty clear this is a deeply entrenched, intensely patriarchal environment.
Oh, absolutely.
So how does that actually manifest day to day for these doctors?
It manifests as absolute, unquestionable authority. The White Tower culture places senior physicians and administrators on an incredibly high pedestal.
Like they can't do any wrong.
Right. You have to remember, a senior supervisor in a teaching hospital isn't just a boss who signs your paychecks. They are essentially the gatekeepers to your entire future. They control academic resources, they control career advancement, and they dictate your clinical assignments. So questioning them isn't just risky, It can be a career death sentence.
So it sounds like the White Tower isn't just a metaphor for prestige. It acts more like a medieval fortress.
I like that.
Like, it shields the lords, the senior doctors, from outside scrutiny, while the moat keeps the vulnerable junior staff trapped inside with absolutely no way out.
That is a brilliant way to conceptualize it, honestly. Because the moat in this scenario is the sheer terror of professional retaliation.
Which is terrifying.
It is. And the allegations at Shuangho Hospital Center entirely on a senior supervisor weaponizing that exact fortress dynamic against female physicians.
Right, the allegations. We need to get into those. The sources point to some really severe violations here, specifically regarding maternal protection.
Yeah, the details they're hard to read.
Walk me through exactly what the Taipei Physicians Union documented, because it's hard to imagine this happening in a modern medical facility.
It is staggering. So according to the union's press release, one of the primary victims was a pregnant doctor.
Okay.
And despite her explicit objections, this senior supervisor forced her to work night shifts.
Which is already bad.
Right, but it gets worse. He mandated that she take on duties that exposed her to the risk of ionizing radiation.
Wait, ionizing radiation? In a hospital setting, aren't there massive regulatory red lines around pregnant staff and radiation?
Absolutely. There are huge red lines. Occupational safety protocols for pregnant healthcare workers are incredibly strict because ionizing radiation poses severe documented risks to fetal development.
That's just basic science.
Right. So for a supervisor to leverage his authority to mandate that exposure, it bypasses just being a bad boss.
Yeah, that's not just bad management.
Exactly. It demonstrates a complete disregard for basic medical ethics, human safety, and strict labor laws. But, it forces us to ask, Why would a highly trained doctor walk into a radiation zone against her will?
Because of the moat. Because if she says no, her attending physician ruins her career.
Exactly. The power asymmetry is so severe that self-preservation just takes a back seat to obedience.
That's heartbreaking.
It is. And the abuse detailed in the sources wasn't just physical endangerment. There's a relentless campaign of psychological and physical harassment.
The psychological manipulation really stood out to me in the sources. There was this detail about the supervisor calculating what he called debts of gratitude.
Oh yeah, that part is chilling.
Explain that a bit.
So he would frame basic professional duties or like standard mentorship as these massive personal favors that these junior doctors suddenly owed him.
Ah.
Yeah, it is a classic transactional manipulation tactic. It's
Yeah.
designed entirely to make the victims feel isolated and deeply indebted to him.
And that isolation was physical too, wasn't it?
Yes, very much so. The union documented how he would use the hidden, unmonitored areas of a busy hospital to force physical contact,
Ah.
massaging the necks of junior doctors against their will, forcing them to hold his hands under the guise of, quote, discussing workplace issues.
Just totally exploiting the environment. But there's one incident in the union's release that is just, it makes your stomach drop.
I know exactly which one you're talking about.
Can you explain what happened in the recovery room?
Yeah, this is perhaps the most disturbing detail in the entire stack of sources. One of the female physicians underwent surgery for a miscarriage,
Okay, just pausing there. That's a huge emotional and physical trauma.
a massive trauma. So she is in the hospital's recovery room, recovering from the anesthesia, semi-conscious.
She's literally a patient at this point.
Exactly. She is a vulnerable patient.
Mhm.
And this senior supervisor uses the excuse of a quote-unquote visit to bypass the restrictions of that highly vulnerable space.
Which he shouldn't even be in.
Right. And while she is lying there, actively recovering, he uses the opportunity to hold and rub her hands.
Oh my God.
And then he later makes comments to her about how her hands were warmer than his.
That is horrifying. A recovery room is supposed to be a sanctuary. To invade that space, to target a subordinate who is literally semi-conscious.
It's beyond inappropriate.
It takes a level of audacity that only comes from someone who feels entirely untouchable.
Untouchable is the key word here. He feels untouchable because he has successfully integrated his administrative power into his abuse. He knows these women rely on his evaluations.
Right. So let's look at what happens when that untouchability is finally tested, because eventually the moat gets crossed.
It does.
At least 3 doctors hit their breaking point and they file formal sexual harassment complaints with the hospital.
Right, which takes incredible courage.
Absolutely. Now, if I'm listening to this, my immediate assumption is that a major medical center, when faced with multiple formal complaints, is going to bring the hammer down.
You'd think so, yeah.
Like HR steps in, the threat is neutralized, problem solved. But the sources reveal a very, very different reality.
They reveal a masterclass in bureaucratic evasion. When you look at the institutional response from Shuangho Hospital, the disciplinary action taken against this supervisor was, get this, 1 minor demerit each.
A minor demerit. That sounds like a high school tardy slip. What does that actually mean for a senior physician?
In practical terms, almost nothing. Seriously. It doesn't restrict his medical license, it doesn't remove his academic standing, and crucially, the hospital kept it entirely secret.
Kept it secret. Unbelievable.
Yeah, they didn't announce the penalty, which means they deliberately chose not to make a public example of the behavior to deter future harassment.
But wait, don't the victims at least get a formal resolution? Don't they get a piece of paper explaining how the hospital is protecting them now?
Under the law, yes, they absolutely should.
Yeah.
Taiwan has the Workplace Sexual Harassment Prevention Measures Guidelines.
Right, I saw that in the notes.
And those guidelines explicitly mandate that victims must be notified of investigation outcomes and the reasoning behind them.
So the hospital did that, right?
No. The Taipei Physicians Union revealed that the hospital completely failed to do this. They didn't notify the victims of the results.
Oh.
They didn't explain the hilariously light penalty. In fact, one victim only discovered her investigation was closed because she had to aggressively chase down the administration to ask what was happening.
Make that make sense for me. Why would a hospital do that? Why hide the ball from your own doctors who are literally asking for help?
It comes down to institutional self-preservation. Acknowledging a severe problem with a high-ranking supervisor damages the prestige of the White Tower.
So it's a PR thing.
Mostly, yeah. The hospital prioritized its brand and its reputation over procedural fairness and the physical safety of its own junior staff.
And we see that self-preservation turn into outright gaslighting when the media finally starts asking questions. Because the hospital had to put out a public relations spin, right?
Right, they had to say something. So when pressed by the media about why one of the victims left the hospital, the administration publicly claimed she resigned due to, quote, career planning.
I have to push back on the administration's framing here.
Please do.
Because if I go to HR and say, I am resigning because my supervisor is physically harassing me and I am unsafe, and then that same HR department turns around and tells the press, I'm just exploring new hobbies and focusing on my career.
Yeah, it's pretty egregious.
That's not just poor management. That's a deliberate cover-up.
And the union proved it was a cover-up. They pulled the victim's actual resignation form.
Oh, wow. What did it say?
Well, she hadn't written anything about career planning. She explicitly wrote on official hospital documentation that her resignation was due to inappropriate physical contact from her supervisor.
So they just lied.
Yes. The hospital's external messaging was a complete, verifiable contradiction of their own internal records.
And the deceptive PR didn't stop there. The hospital also claimed they took immediate action to protect the remaining victims by separating the perpetrator and the victim, like moving their offices.
Right, they made a big deal about that.
But the union caught them in a lie there, too.
Yeah, the union pointed out that the hospital was claiming credit for a geographical reality that already existed.
Wait, what do you mean?
Their offices were already in completely different areas of the facility before the complaints were even filed.
Are you kidding? So the hospital did literally nothing to change the day-to-day dynamic.
Nothing operational, no.
Wow.
The reality for the victim was that she still had to attend department meetings with her abuser. The hospital forced the burden of protection entirely onto the person being abused.
That is so backwards.
It is. She had to figure out her own excuses, map out her own routes through the hallways just to avoid him.
Okay, if the hospital is this committed to a cover-up, why didn't these doctors just bypass the hospital and go straight to the government? That's what regulatory bodies are for, right? If your boss is breaking the law, you call the authorities.
You would think so. But this is where the sources highlight a massive, dangerous flaw in the wider healthcare system. It's a phenomenon of regulatory paralysis.
Okay, explain that.
Well, new Taipei City Councilor Huang Shuchun is cited in the sources, and she points out that the oversight is deeply, hopelessly fragmented.
How fragmented are we talking? Like 2 or 3 agencies?
Worse. Let's break down the jurisdiction. Because this is a teaching hospital, you are dealing with 3 completely different identities for everyone involved.
Okay.
They are treating patients, which falls under the Central Ministry of Health and Welfare.
Makes sense.
They are employees, which triggers the Ministry of Labor.
Okay, that's 2.
And because it's an academic environment and the supervisor holds teaching roles, the Ministry of Education is suddenly involved.
That's a central government. What about the local level?
Locally, you have the new Taipei City Department of Health, the Department of Labor, and the Department of Social Affairs, all holding pieces of the puzzle.
Wait, so that is 6 different government agencies with overlapping jurisdiction over one hospital.
Exactly. 6 agencies.
It's like a medical code blue where 6 different highly trained specialists rush into the room, but instead of doing CPR, they stand around the bed arguing over who officially owns the clipboard while the patient flatlines.
That is the perfect analogy.
Because everyone has jurisdiction, which means nobody actually takes action.
And the tragic irony is that all of these laws, the gender equity laws, the labor protections, the medical guidelines, they were genuinely designed to protect victims.
The intent was good.
Right. But when the enforcement is spread across 6 agencies, you get administrative ping pong. An investigator from labor looks at it and says, well, they're a medical student, so this is an education issue.
And education just passes the buck.
Right. Education says they are in a clinical setting treating patients, so it's a health issue. This fragmented bureaucracy ends up forming a complex shield that inadvertently protects the perpetrator.
Wow.
The system itself becomes a secondary abuser, exhausting the victims with paperwork until they just give up.
But wait, wasn't there supposed to be a new database specifically designed to cut through all this red tape? The sources mentioned something called the Wolf Doctor platform.
Yes, the Wolf Doctor platform.
That sounds like a centralized solution to track abusers across the medical field, doesn't it?
On paper, the Wolf Doctor platform sounds like a robust safeguard. The mechanism is simple. Aggregate substantiated reports of misconduct into one database, so patients and hiring boards can see who is dangerous.
Right.
But Think about how that data gets collected. A database is only as good as the data entered into it.
Ah. If Shuangho Hospital keeps the minor demerits completely secret.
Exactly. If the hospital refuses to publicly report the misconduct, the Wolf Doctor platform remains completely empty. It's garbage in, garbage out.
That makes the platform basically useless.
And furthermore, the union highlights a massive failure by the local health department regarding Article 25 of the Physicians Act.
What is Article 25?
Article 25 is the legal threshold required to actually revoke a doctor's medical license for severe misconduct.
So the ultimate penalty.
Exactly. But the local health department failed to step in and invoke it.
Unbelievable.
So without the hospital reporting the behavior, and without the health department revoking the license, the Wolf Doctor platform is reduced to an empty gesture. It provides the illusion of safety without any actual enforcement.
So where does this leave us? The victims are forced to resign, the hospital lies to the press, and 6 different government agencies effectively shrug their shoulders. Does the supervisor does he just get away with it?
That is the lingering threat detailed in the union's December 2025 press release. The accused supervisor remains completely embedded in the system.
You're kidding.
No. He still holds his teaching positions. He still holds important roles within various medical societies. He still controls academic resources.
So he still has the exact same power over the next generation of young, vulnerable doctors.
He does.
And according to the sources, he has never offered a sincere apology to the victims. He just went right back to work.
Which forces us to look at the broader implications here. When a medical center allows a perpetrator to maintain their status and power, after multiple substantiated complaints of harassment and endangerment, they are sending a clear message.
Yeah, a really dark message.
They are normalizing gender-based mistreatment. They are telling the entire staff that patriarchal culture is the absolute rule of law, and that junior female physicians are acceptable collateral damage as long as the hospital maintains its academic prestige.
And that brings the stakes of this entire deep dive directly back to you, the listener. Because, we literally trust these institutions with our lives.
Exactly.
When you are sick, when your family members are in crisis, you go to these hospitals expecting a safe, focused environment. But if the doctor treating you is exhausted, terrified, and constantly strategizing how to avoid being cornered by her abuser in the hallway, how can we as patients possibly expect to receive high-quality care?
You can't separate the two. That is the ultimate takeaway from the professional summary we analyzed. Macro policy directly impacts microcare.
They're completely connected.
Patient care quality is intrinsically linked to staff well-being. A physician operating in survival mode just cannot perform at their highest clinical capacity.
No, of course not.
Tolerating harassment doesn't just ruin the career of the individual victim. It causes a systemic, dangerous erosion of public trust in the entire healthcare governance structure.
So as we wrap up, what are the sources actually demanding? They are acting as a glaring siren that urgent foundational reform is needed.
Absolutely.
We need standardized reporting pathways that victims can actually trust. We need truly independent investigation mechanisms, not internal committees that are terrified to punish their own star revenue generators.
Right.
And we need a zero-tolerance approach to dismantle the massive power imbalances in academic medicine.
It requires an absolute cultural transformation. Accountability has to extend beyond secret internal HR slaps on the wrist. Gender equity and basic workplace safety have to be integrated into the very core of how these hospitals are governed.
I want to leave you with a final thought to mull over today, building on this whole idea of how power operates in the shadows. If an entrenched hierarchical system can completely silence highly educated, essential professionals like doctors inside a modern, well-funded medical center, take a hard look at your own industry. Where are the white towers in your field? And if you suddenly needed to report an abuse of power today who actually holds the keys to the grievance box,